I'm next going to show you wet methods of cupping. And the first method is true traditional wet cupping. And this is the type of cupping that is historically prevalent in the Middle East. This is what's called Hijama type cupping. And this is when we were talking about the historical view of cupping. This is when cupping and the wet method first became used to pull exogenous factors out of the body by releasing stagnant blood using a lancet. And we're not doing venipuncture here. We're not using, a hollow needle. We're not sticking anything into a vein. We're just going to use a really small, sterile bleeding lancet in order to release some of that stagnation that we see with the cup. So what you're first going to do is make sure that your client is prepared, that the area is available to you, and you're not going to put any oil on your client. So instead, what you're going to do is make sure that the area does not have any oil on it, and you're going to swab it with alcohol, and then just make sure that that alcohol completely dries. Then you'll apply a single cup. So you're going to select the area for cupping, and usually this is done in cases of focal pain, pinpoint pain, extreme stagnation. So in selecting a wet cupping method, such as bleeding cupping like this, it's because your client will say, oh, I just can point to this particular region, for example, on my back or my neck, and that is really extremely painful. And that will be your target. So what we're doing here by placing this first cup, this is going to set the stage for what you do with the bleeding. So you'll place the very first cup here and wait for the skin to draw and then start to change color. So you can leave this first cup on for about 5 minutes. And this not only serves for you as the practitioner a target for where you're going to lance the skin, but it also has indicative value in terms of what you see here is the skin is starting to change from, this red to the dark red, or maybe even in some clients purple. And now you can see that this really is the appropriate choice for lancing the area because you're going to be able to release a lot of stagnation. Because we are dealing with body fluids and blood intentionally here, really make sure that you're wearing gloves and employing your PPE measures. All right, so now you have your target here that you already placed the cup and had it on for several minutes, and the skin has turned red and in some cases dark purple. So now you're going to take your sterile lancet and you're going to lance this area 3 to 10 times. So sometimes I like to count down for my clients. I like to say, okay, I'm gonna count to 10 and here I go. Other times clients just don't want to know what's happening. So here I'll go ahead and tell my model, I'm going to count down from 10, and during that time I'm going to put this lancet into the area 3 to 10 times, okay? So 10, 9, 8, 7, 6. All right, we're all done, okay? And then now you're going to take your cup, and this is medium to strong suction, and just place the cup right over here. And you'll leave this cup in place for about 5 minutes. And during this time, what you'll see is that several drops of blood are starting to be expelled from the skin. And as you go through the treatment, more and more blood will come out. And approximately 1/2 to 3 ounces of blood will be removed from the skin during this treatment, and it will come out in a semi-coagulated form. And when you're done with your sharps container, of course, you'll put your sharps container, when you're done with your lancet, you'll put your lancet directly into the sharps container. And now it's just a waiting game. You're waiting for the appropriate amount of blood to come out. And you'll know that the treatment is done because no more blood is being removed from the skin. So you're just going to kind of wait here, and the blood is going to come out, like I said, in this semi-coagulated form. And more often than not, if your client really has this pain condition, this recalcitrant pain, or maybe even acute pain, the blood is going to be dark. And in Western medicine, color of blood doesn't necessarily mean anything, but in Chinese medicine, the color of the blood means everything. So what we're looking for is this really dark, thick blood. And the darker the blood, it means there's more stagnation and there's more deep qi stagnation, more deep blood stagnation in the area. So this is a really strongly dispersing technique. It powerfully regulates qi and blood, which means you only want to use this on your strongest, most robust clients. So this is contraindicated in anyone who is pregnant, anyone who is weak, frail, deficient, recovering from an illness. Also sometimes people who are queasy or concerned about blood. You also may only want to do this on their back or not show them the blood. This is contraindicated in pregnancy as well as children of all ages, as well as any anemic clients. The range of application with wet cupping is it's really, really great for sports injuries with blood stasis. I see a lot of clients who come in and say, oh, I used to play football back in college, and then I just never really got rid of this pain in my back, or, I used to do something and now I have all this pain in my shoulder. This powerfully disperses that long-term chronic stagnation. This is also really good over surgical incisions. So as soon as someone is cleared to get wet cupping after their surgery, after their incision is completely healed, this will also help to dissipate the stagnation that occurs just from surgery itself. This is great over insect bites and stings. So you can, especially if someone comes into you right away after they've received an insect bite, you can do this wet cupping over the area, and that will really help to pull everything out so you won't get the long-term effects there. I also use this clinically in hypertensive patients, so people who have excessive hypertension, where they're getting, red face, dizziness, ringing in the ears, headaches, that type of presentation for hypertension, taking a little bit of blood out in terms of wet cupping. You do this at the base of the neck. That's also a nice help for helping to lower blood pressure. I also use wet cupping when it comes to frozen shoulder. It's a really nice pair with acupuncture for helping to alleviate the adhesions in the shoulder. And you know that you're done here because there's not more fresh blood coming out of the incision. So it looks like these blood droplets are just kind of hanging out. There's nothing else new happening. And what we've gotten out of this lancing is what's left here in the cup. And like I said, this is starting to kind of coagulate, and that's perfectly normal. To remove this cup, what you're going to do is get some paper towels and place them really carefully and closely to the mouth of the cup. And then you'll press down and then quickly scoop that blood into the cup. And then if there's any remaining blood coming out of the client's skin, then you'll go ahead and cover that with sterile gauze. But if you've left the cup on an appropriate amount of time until the bleeding has stopped, then there shouldn't be any more blood happening around here whatsoever. The marking here with wet cupping is a really interesting presentation. So you did kind of 2 rounds of cupping here. So the first round of cupping, you had a nice target, and then you lanced and you did it again. So the marks here, you can see that there are more severe marks where you've lanced the skin, and then you kind of have a lighter presentation around, and then we have a darker ring. And so that comports with what we were doing, is we were pulling blood out of the area. So this area has become a lighter red because now all of that has basically gone into the cup. All right, so I'll show you this coagulator, this congealed blood. Affectionately in acupuncture, we call this a blood worm because it just kind of looks like a little worm, and you can see how much this blood has really congealed. And in Chinese medicine, we would call this dead blood or old blood because it just has that dark color and it's really stagnant and really thick and sticky.